another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is a good friend of mine, Dr. Michael Magwood, and he'll be speaking on strengthening the pelvic floor, a prenatal necessity. Specializing in pediatric and prenatal chiropractic care, Dr. Magwood is certified by the International Chiropractic Pediatric Association and in the Webster Technique. Opening the IM X Pilates Studios within his practices in Clifton, New Jersey and New York City has allowed Dr. Magwood to provide additional services to create and build upon spinal correction and physical rehabilitation. Dr. Magwood provides true family wellness solutions, first and foremost, to educate and adjust children and their families towards optimal health through natural chiropractic care. Dr. Magwood strives to help people feel less pain, but more importantly, to teach them to think, speak, and behave in ways that are truly uplifting and transformational in their lives. As a result, people are less dependent on doctors and more confident in their ability to heal. For more information, please visit his website at purebalancecenter.com. Welcome, Dr. Magwood.
Hi, thanks for having me.
Oh, I'm so excited to hear more about the importance of Pilates in strengthening the pelvic floor, because we actually did our training together with the ICPA, getting our pediatric certification, and so we both are really aware of how important a strong pelvic floor is, not only during pregnancy, but in preparation for birth. So I'm excited that you'll be able to share your knowledge on great ways for women to strengthen their pelvic floor. So let's start off by talking about why is it important to strengthen the pelvic floor during pregnancy?
Well, there's a couple of reasons. We know certainly that it's common that urinary incontinence related to pregnancy is an issue that most women want to prevent, and strengthening the pelvic floor has been shown to reduce the incidence and the severity of that in the late stages of pregnancy and after birth.
That's really important.
Yeah, we also know that even the pelvic floor plays a role in the labor process. So not only do we want to stabilize, the abs, as they say, we want to work that whole region all the way down to the pelvis itself. Some of the things that we do with breathing as we prepare for an exercise move, we're pre-contracting the entire core, and specifically the transversus abdominis. And most people know that that's a deep abdominal muscle that encircles the whole trunk. So when we force an exhale out, we are actually going to pre-contract that. And we found some pretty interesting science on the intention of contraction of the abdominals. If we measured muscle contraction through EMGs with a forced exhale, even before the person actually squeezes the abs consciously, we're also seeing a 10% contraction first. It's very interesting.
Wow, that is interesting. Okay, so we know that a stronger pelvic floor is important to help prevent incontinence, which every lady would like that. How else can a strong pelvic floor help us?
Well, certainly we want to look for the alignment of the pelvic system.
Mm-hmm. That's right.
If we're going to have a system that is balanced first, and as you, of course, have shared with all of your patients, an effect where there is no interference in the communication of the brain to body and back, alignment balance does a great deal to keep the nervous system flowing freely. And for us, that's really important when we're thinking of developing unborn children. You work the pelvic floor, it stays aligned with elongation exercise, stabilization exercise, and of course, our chiropractic alignment. Then we're going to have great benefit in, many things, as you know, helping the baby to find the best position for birth, and therefore we're looking into the future of babies that have easier, safer deliveries. And every mom wants that too, don't they?
That's right. So important. So to your point, by having a stronger pelvic floor, it potentially could really help a woman hold her chiropractic adjustments more effectively during pregnancy, right?
I believe so. And when we talk about holding adjustments, have you ever heard a patient that just says, oh, I only held my adjustment for like an hour and I knew I needed to be adjusted again. You ever hear that?
Yeah. Yes.
I think sometimes people are a little bit, they're too worried about it. And sometimes I think we just adjust, and the patient should take that in and have confidence in the innate ability of the body to do with that information what it needs to. And they don't have to worry. But we also realize that when we're conditioning the body, I think sometimes the body's more prepared to receive an adjustment, and people can sometimes sense or intuit that.
Yeah. I definitely think so. I see that patients that are exercising in addition to their adjustments are definitely getting better results than if they just get adjusted alone.
Yeah, well, sometimes people in the practice, they'll come and they'll take an IM X session, IM X Pilates, that is, and they'll get adjusted either before or after. And I've always tried to figure out, well, is it better to be adjusted first or after? And I decided, well, both maybe is best. What have you thought about that?
That's interesting. And, patients certainly ask me, should I work out before or after? Should I get a massage before or after? And it's, typically I don't have a great response for that. I almost feel like whatever works best for your schedule and whatever creates the least stress is the best to do. So I'm almost looking at it from more of an emotional component as opposed to the physiological component. Right.
Well, I also know that when I'm doing sessions, if I'm adjusting first and somebody does go through an exercise session, we might notice something that's showing up, asymmetries, imbalances, things that might be have tweaked themselves that we could always readdress at the end. And so occasionally we'll get somebody back to the table for some more fine-tuning from a chiropractic perspective.
Yeah. That's really cool that you have that right in your office, so people technically could do before and after, and it's very convenient for them to do that.
Yeah, and they realize that I don't mind the extra work either.
Oh, that's generous of you. So we talked about pelvic floor strength, helping to hold that pelvic alignment. That impacts the position of the baby, being in a vertex head-down position. It creates an easier labor and delivery because of that proper positioning. What about having strong pelvic floor muscles during the actual birth? How does that impact the birth?
Well, certainly the ability to push, having a strong core is very valuable.
Yeah.
And I think when we get into transversus abdominis, that plays in my opinion, a bigger role because that muscle encircles the trunk almost like a corset. It really contracts the abdominal, it compresses the abdominal cavity, and I think that's a big supporter during pushing.
Mm-hmm.
We also find that with that strong, people will recover quicker from labor after the fact.
Yeah.
And that's very important as well.
That is. Can you speak a little bit more to how having a strong pelvic floor will impact quicker postnatal recovery?
Oh, well, ultimately, when it comes to, like, let's say a main muscle, pubococcygeus, it lies around the openings of the urethra, the vagina and the rectum. So we talk about strengthening the pelvic floor, and it's common that even before the birth, it's shown to help with the incontinence like we talked about. And afterwards, we realize that it's easier to recover. So even if we're doing those exercises after the fact, well, we've already conditioned and prepared strength in before. So if there's trauma, the concern is, well, how is the recovery going to work? And what's the other benefits? Well, to me, getting back to a normal life, getting back to pre-pregnancy status. It may take 9 months for that to happen, but we're seeing that a lot of our women are getting back to their fitness sooner, and they're feeling like they're just not quite so beat up from the process.
Mm-hmm. There's probably some muscle memory, so having a strong muscle, even if there is, let's say, some tearing during the delivery, that muscle can heal faster because it was in a strong, healthy place prior to the birth.
I would say so, and I also think that our chiropractic ease that we're creating with an aligned spine and pelvis, that plays a big role as well.
Yeah, it definitely does, and that's because of the nervous system component, for sure. You know, one thing, too, I was thinking of, if during pregnancy, for example, by strengthening the pelvic floor muscles, it's actually, in a lot of ways, helping the pelvic floor muscles be more stretchy and pliable, which is really hugely important, obviously, during birth as the pelvis is opening and the baby's coming out. And it's interesting because a lot of people think that, you know, a tight muscle is a strong muscle, when we actually know that's not true. It's the opposite. So there could be women with extremely tight pelvic floor because of weakness and scar tissue. And I'm assuming that the Pilates is very helpful for stretching and opening that up.
Yeah, the flexibility thing is interesting. At least in an IM X Pilates standpoint, we don't do as much of the deep flexible work with our pregnant patients. And obviously we want to be cautious as to not to strain muscles, particularly in the obliques, the abdominal obliques, the muscles to the sides of the abdominal region. But ultimately the stamina that we can create, it does make flexibility easier for people, because even then they're finding that they're fatiguing. We're fatiguing people even in the flexibility stage of our program.
Mm-hmm. Okay, which allows the muscle to relax and let go.
Yeah, and it really does.
It's huge.
And from a number of different planes of motion as well. So if we think of getting into a stretch position, a lot of the times when we're using a reformer, we're easing dynamically into a length position. So, of course, we're avoiding the bouncy or static type end range. We're flowing through the movement, which is really comfortable for people.
Mm-hmm. So can you tell us a little bit more about what IM X Pilates is and how it's different from other types of Pilates?
Sure. IM X was designed with a few things in mind. One was to eliminate some of the more extreme and dangerous exercises that may have occurred originally. And I think that we all can appreciate the original work that was done in hospital beds. But IMX stands for Integrated Movement Exercise, and it's re-choreographed in protocols. And it makes it safe and effective for just about anyone, even our let's say, our back pain patients. So a lot of our protocols, a lot of our instruction, our cues, even our fundamentals, physiologically, biomechanically, they're all set up so that the language is very science-based. It's anatomically based. So we're using medical words, medical language, and not so much of animal names or names that don't have specific things that can be figured out. So that's one of the things that makes IMX unique. Also, we looked into a lot of the research that went in, and I was excited to find out that one of my undergrad professors from University of Waterloo in Ontario, his name and some of his studies were listed in the course manuals. And that was
funny.
Pretty exciting for me. That's how I knew I was in the right place.
Yeah, you sound a little bit like a science geek there.
Oh, no, I didn't. Well, there's safety things.
Yeah, safety, and the science and research is important.
I think so. And the truth is we're going for different purposes. If we have IMX for back strength and rehabilitation, that's great for patients, but we also have IMX certified trainers that they're not the doctors doing the work. We have classes where some of our most fit people will come in and do advanced work, and they're just coming in to sweat. They're just coming in to wear themselves out and stumble out of here exhausted. So there's very different things with that. And then with our pregnancy program, we have some variations that obviously some things we won't do during pregnancy that we would in a more advanced class. Actually, one of the things, Dr. Brayton, that you would find interesting. The pregnancy pillows. Do you use those in your practice?
No, I don't.
Well, you know what I'm talking about. A mom can lie on her belly.
Yeah, I have my table drop out.
Yeah, another method. Very good. But we use those pillows, and we can actually place them on the reformer, so a mom can do some low back extension type work or prone exercise even with the belly.
That's very
surprising.
Cool.
A lot of our moms haven't thought that was possible for some time.
Yeah. So,
and that's one
as
of the
we're
things I was creative with.
That is, and that's a chiropractic mentality. Because we do have patients go prone or face down during our adjustments, even through 9 months of pregnancy. So we have tools for that.
Yeah, exactly.
That's cool. Now, with this pregnancy protocol with the Pilates, are there different exercises depending on which trimester you're in?
That's such a good question. And I think people are on different levels. We don't start anyone at all in the first trimester if they've never done it before.
I see.
And it's more of a precaution thing than an actual, necessary rule.
But a woman who has been working out, she can do it through her first trimester if she has previous experience. Yeah,
we'll keep people going, for sure.
Yeah.
We may be more cautious with some of the cardiovascular component. Even our jump program, it's still very low impact. However, we want to minimize impact, in general. And then I think as we get into later stages, we're going to minimize or eliminate completely any of the supine stuff where moms are on their back for a long period of time. And if people don't know the purpose of that, well, we want to not put pressure on blood vessels from the weight of the baby.
Right. So would that typically be like around the beginning of the third trimester, or week 28?
Yeah, typically about that. So we can do a lot of side-lying work to take up the time that we'd otherwise be doing on our backs. I also think some of the important differences are rotational work, where we would get a lot of oblique strengthening for our fitness members. As the abdominal muscles begin to stretch, they become a little more at risk. So we don't do a lot of the rotational work where we'd be stretching a lot of those muscles.
During pregnancy?
Yeah, during the later stages, for sure.
Yeah, and that's also probably great to bring back in postpartum to help get that corset back into place.
Yeah, exactly. A lot of it's energy, too. We tend to work more one-on-one with our moms unless we have moms around the same stage and they want to make friends and they want to do small groups. But I also noticed that in different stages, moms have different energy levels, too. And during the last month or the last few weeks of pregnancy, the desire to really sweat and work hard tends to fade just a little bit in the majority of my cases. So we don't work them too hard. We may even shorten the session from 50 minutes to 40 or 30 or 20.
Mm-hmm. Yeah, that makes sense. I mean, it's definitely a time to start really conserving energy in preparation for the labor.
Yeah, it makes sense to me.
Yeah. So,
and you and I were both intuitive. Oh, sorry, go ahead.
Exactly. I was going to say, you had mentioned reformer, so you're working on a reformer. Is there any other type of equipment that you use with your pregnant patients?
I haven't done other formats in IMX other than IM X programs on the floor. They tend to mimic what's done on the machine to the extent that they could. And for the most part, our reformer machines, or we call them exercisers in IMX, they're the most popular. And just people love to be on equipment. But for the most part, if a mom was coming in 3 times a week, my suggestion would be do 2 classes on the machine, do 1 on the floor, just so we can get variability and just sort of a different demand in the same fundamentals.
I think it's good to mix it up.
We also have a cycle program, but we don't. We haven't put any of our pregnant patients in the cycle program yet. You've heard of Tower?
Yes.
we have a tower that's linked to bicycles, and so we can do somewhat of a spin program while adding upper body stabilization work against spring resistance. It's pretty fun. It's way more fun than I ever would have thought.
That sounds quite challenging. So that might be good, like postpartum, get my body back type of thing.
Yeah, when people want to lose the extra weight and there's no waiting allowed, they can sweat really, really nicely on that. Plus, they're going to be stimulating contraction of the transversus abdominis and the core muscles the same way they would in the other IM X reformer programs.
Very cool. All right. Is there anything else you wanted to share with us about IM X Pilates and strengthening the pelvic floor?
Well, I guess the one thing that I was really proud to see scientifically in the literature, and obviously looking out for the safety of people, the IM X protocols they satisfy the standards for the ACOG, the American Congress of Obstetricians and Gynecologists. And then in the end, we've ended up having a fair number of our colleagues, our doctors, our medical doctors, referring moms over to us for our program. So I'll just put out there how grateful I am to have really astute, intuitive, collaborative medical doctors in the field of childbirth. Not everyone is just doing routine C-sections. It's pretty good.
And you're seeing that in Clifton as well as New York City?
In New York City, I'm relatively new, so I don't have all the connections yet. But in my very first week, I popped in to an obstetrician's office on Madison Avenue and just introduced myself. And by the time I returned back to the office, there had already been a patient of theirs who called to schedule a checkup. So doors are wide open. And they literally said to me, "We hope you have business cards." Exactly what you're doing.
That's so cool.
So that was a nice hello, because you never know. In New York City, you might just get a door slammed in your face.
You never know. So you found a nice neighbor, which is awesome. I'm sure you attracted that. That brings one more point that I think is so important. We were really focusing on, the pelvic floor, strength, but really with the Pilates workout during pregnancy, this is going to help women with the lower back pain, I'm assuming like sacroiliitis, upper back pain, like some of the common neck and back pain issues that can occur during pregnancy.
Yeah, it really will. I think, to me, and tell me how much you agree with this, I really feel like as the pelvis begins to work against the forward stress of the weight of the baby, the anterior pelvis and its tilt, that tends to really be one of the major increases in discomfort. Do you think?
Yeah. Totally. I totally agree with that. And, that's where the alignment, spinal alignment, and the postural strength is so huge. So the pelvic floor is part of that, but there's also all the other spinal muscles and the abdominal muscles that help to hold that woman upright. Even as her breasts are getting larger towards the end of the pregnancy, everything's getting pulled forward, and that can create a lot of stress on the spine and the nervous system.
Yeah, I totally agree. And sometimes I think things like pubic symphysis disorder, or pubic symphysis syndrome, these things are so painful for people, and there are actually, for us, quite simple ways of addressing them. That's right. That is totally right. I had a patient recently in my office, could barely walk. She was in so much pain. Her OB said, well, you could use a cane. That's what typically women do. And thank God she did some research and found out that chiropractic might help. She came into my office, and we were able to resolve the issue within a couple of adjustments, and she was so grateful. Yeah. Well, the other thing that we see in terms of resolving things, if we see a rectus diastasis, so common, where the middle abdominal muscles sort of split and stretch out sideways, moms are really concerned about that from a strength and physical injury perspective to, how it looks. And we've seen that we're going to be able to build that strength in that region that we can hopefully, and I've never seen a case from someone who's gone an entire pregnancy with us where we've seen that, thank goodness. And we're also seeing people postpartum where we're literally doing the measurements of the separation. And the IM X program is appropriate for rehabilitating that. And we've seen that dimension shrink. So I'm thrilled about that because I know a lot of abdominal exercise has been shown to make those things worse.
That's right. And typically a traditional Pilates would make that worse. So I'm really excited to hear that this is good for it.
We're very specific in how we do these things. And again, that's typically one-on-one type of work. And, it's been pretty exciting.
That's so important to work on that separation. And, it's also interesting. I've seen that happen a lot with women that were, very athletic. And in a lot of ways, you would assume that they had extremely tight abs. But in a lot of ways, their abs were so contracted that they were in spasm. And that was the reason why they had that rip or that separation. And so there's something to be said for having strong muscles that are pliable and can stretch during the pregnancy and isn't going to create that diastasis.
Yeah, and I think the only other way we would prevent that is maybe double the length of the pregnancy so the growth is more gradual. I don't know any moms who would want that.
No. Unless you're an elephant, they have a 2-year gestational period, but us humans, we go 40 weeks plus or minus 2 weeks.
Yes, and hopefully not plus because then everyone thinks the world's coming to an end.
Well, and I just want to say, since you pointed that out, 42 weeks is normal for some women, and it does not mean the baby is overdue. So that due date is an estimated due date.
Well, we had a new mom come in this morning, actually, and she's pregnant with her second child, and right at 40 weeks, her doctor insisted on a C-section, and to this day, 18 months later, she's certain that if she just would have waited another couple of days, it was happening. And she just felt this pressure, and for no real clinical reason other than just, let's get it done. And I hear that story often, all too often.
Way, way too often. That's definitely become an epidemic in this country, and that's why our C-section rate's 1 in 3. That, in my mind, that would be considered an unnecessary surgical birth. It's much harder recovery. Let's talk about that. That's one more thing to wrap this up. What if a woman does need a C-section? Sometimes they are certainly medically necessary and life-saving. How could a woman rehab her abdominal wall post-cesarean?
Well, I would say very similarly, I would give them a little more time before they begin. That's the only thing. Certainly, what I've understood, and tell me if you agree, the mom has the sensation, if they're hurting, I still believe there's more time to wait. But a lot of what we do, sorry, I'll let you comment on that.
No, I agree. If there's pain, then, and that's such a good point. The average, healing after a cesarean, they say, is 6 to 8 weeks. And some women need longer. Some women need 12 weeks. Everyone's body heals at a different pace. Yeah.
So what I've found is really helpful is, in terms of at least IM X Pilates principles, for some of our moms, we will suggest doing some of the breathing protocols in the absence of the movement protocols. So they're already getting the pre-contraction of the transversus abdominis, and they can do certain positions. They can use the IM X ring for pelvic stabilization without doing anything very extreme or drastic, and that they can do early on.
That's really cool. So they can start to do very gentle exercise. How early on would you recommend?
As soon as they're ready. As soon as they figure out what being a mom's all about.
Yeah.
So that if a mom's scheduled to get her adjustment right after the baby's born. A lot of time it gets postponed a few days.
Yeah.
As they figure out, what the heck is going on with being a mom all of a sudden. That's
right. Yeah, sometimes it needs to wait a week. That's so true.
But as a parent, I've realized that a lot of the things that you think are intuitive or make sense, it throws you a curveball or two being a parent, no doubt.
Mhm. Right. So there's a lot of just going with the flow. And, I think the other thing to reiterate is as much as postpartum you want to start working out and, losing the baby fat and getting your body back, if it doesn't feel right, if you feel like you're not feeling well or the incision's still healing, then you just wait. And it's okay. An extra couple weeks is what your body might need in the healing process. So it's important to listen to that.
I agree, and some of our moms are so ambitious, and it's admirable. But sometimes we need to just be supportive and just lead them.
Yeah, that's right. Wonderful. So if
it's
a
great
woman,
to have doctors like you doing that work.
Yeah, thank you so much. I love it. I totally love it. So if a woman is looking to find an IM X facility or studio in her area, she doesn't live near Clifton, New Jersey, or in Manhattan, how can she find one?
The corporate site, the website is imxpilatesstudio.com, and there's a whole bunch of information on there about certifications and how the franchise system actually started. On all of the individual franchise sites, if we went to imxpilates.net, that's the New York City studio. Under the Contact Us, there's a list of not just how to reach us specifically, but every studio in the country, and there are many states.
Every state has one?
I wouldn't say every state, but we're getting there. And, it's really a growing thing, and we really want to get more and more chiropractors and other, even physical therapists involved. It works well as a standalone fitness studio, but it really does make sense to incorporate this in the chiropractic world.
Mm-hmm. Oh, that's really cool. Awesome. Well, thank you so much for sharing your knowledge and wisdom with us today. I really appreciate it.
It's always fun sharing with you and chatting.
Yeah. All right. Thank you.